Hello.
How are you today?
I'm doing well.
Can you tell me your name and your birthday?
My name is Derek Boyer. Date of birth is 05/09/1990.
Okay, thank you. Well, my name's Amanda. I'm going to be the nurse practitioner student that's doing your exam today. If you have any questions at any point, feel free to stop me, okay?
Yep.
I'm just going to ask you a couple questions here. Can you tell me what year it is?
It's 2023.
And what's the month?
It is April.
And the season?
Spring.
Day of the week?
It is Tuesday.
It is, yeah. And then can you tell me what country you live in?
The United States.
And what hospital is the closest to you?
Genesis.
And then I'm going to name a couple objects, okay? So apple, pen, and table. I want you to remember those.
Okay.
So can you repeat those objects back to me?
Apple, pen, and table.
Okay. Can you subtract 7 from 100?
93.
And then another 7?
86.
And then another 7?
79.
Another 7?
72.
Another 7?
65.
Yes, very good. I also want you to name those 3 objects.
Apple, pen, table.
Good job. Okay, can you tell me what this is?
That is a flashlight.
Yep. And then what is this?
A stethoscope.
Okay, very good. Can you repeat no ifs, ands, or buts?
No ifs, ands, or buts.
And then I want you to touch your nose and touch my finger. Okay? And then I'm just going to take a look at your skin first, okay? So here I'm just taking a look, at your posture, really. I'm going to lift your shirt up here. Just taking a look for your skin assessment. So I see you do have a tattoo on your left shoulder, as well as your right rib cage. I don't see any open wounds or lesions on your back. Your skin is pink, warm, and dry. I'm just looking up your arms here. It looks like you have some goosebumps. Must be a little cold in here. So I don't see any open lesions on any of your arms, as well as your legs, and your skin is pink, warm, and dry there as well. I'm going to take a look at the top of your head here. Okay. So I don't see any open lesions there. Just going to test your skin turgor here. Okay. So he has good elasticity on his skin. Nail beds are nice and pink. Cap refill is less than 2 seconds. Okay. He appears well kept. He is clean. We'll take a look here just at your distribution of your hair. He is bald on top. It does have sideburns going down into the beard. His beard hair is coarse. It's evenly distributed. I'm just going to kind of part your hair here just to take a look. Make sure you don't have any lesions or anything or nodules in there. There's no lesions or nodules that I can see or feel. Eyebrows also, hair is evenly distributed. It's fine up there. What we're going to take a look at next, is your nail beds. So I'm just checking for clubbing here. So what I want you to do is just hold your fingers together, so thumbs together just like that for me. Yep. And he has normal angle of the nail beds. It's less than 160 degrees. Like I said, his nail beds are pink. He doesn't have any streaks. No signs of any subungual hematomas on any of his nail beds. His nail beds are clean, well kept. Okay, and they are smooth and flat, which is good. The next thing that I'm going to take a look at is just the symmetry of your scalp. Looking here, it does look symmetrical. I'm just going to palpate all the way around. He doesn't have any depressions. It does appear symmetrical. I'm going to go ahead and just measure your head circumference here. Okay, we're at about 23.5 inches. So, there's no lesions on his scalp that I can tell, no trauma or signs of previous trauma noted. We'll also take a look at your facial symmetry. I'm just going to have you smile for me. Yep. Okay, puff your cheeks out. Okay, can you raise both your eyebrows for me? Yep. All right, so his face is symmetrical. He doesn't have any unusual features or pigmentation. No tics that I can notice. And then we'll take a look at your sinuses here. I'm just going to go ahead and press on your frontal and your maxillary sinuses. Just let me know if you have any tenderness with that. Tenderness? What about here? Okay, so no tenderness to the frontal or maxillary sinuses. They all appear patent. Okay. And then what we'll take a look at next, you didn't have any tenderness with me palpating over your scalp here, did you? Okay. So no tenderness there. I'm going to take a look at your neck. So his neck is in normal alignment. It's aligned with his shoulders correctly. I'm just going to palpate down your neck here. Any tenderness? Okay. Then I'm going to have you just look up slightly for me. Locate the trachea. His trachea is midline. Okay. So trachea is midline, which is good. Go ahead and swallow for me. Okay. So he has good movement, no tugging with swallowing. I've also located his Adam's apple, which is here. And I found his thyroid cartilage as well. His hyoid bone moves appropriately when swallowing. We'll go ahead and take a look at your thyroid now, okay? So what I'm going to have you do is just look straight ahead for me. And then I'm just going to just palpating here. Okay, so I don't feel any nodules. He has normal movement of the thyroid. And then what I'm going to do is just take a listen here, okay?
Yep.
I'm listening with the bell of my stethoscope for any bruise. Go ahead and hold your breath for me. Okay. You can breathe. Go ahead and hold your breath again. Okay, so no bruise noted with the thyroid. He didn't have any enlargement, and was it tender at all when I was palpating? Okay, so no tenderness with palpation either. We'll take a look at your lymph nodes now. Just let me know if you have any tenderness when I'm palpating down your lymph nodes, okay? So we have the pre-auricle lymph nodes here. Any tenderness? Okay. And then we have down below the post-auricular. Any tenderness? Okay. The occipital lymph nodes. Any tenderness with palpation?
Nope.
Okay. And I cannot feel any of these currently. The sternocleidomastoid. Any tenderness? Okay. What about your anterior deep cervical here? Okay. What about down in here?
Nope.
Okay. Now I'm going to just do your submandibular here. So any tenderness with palpation. Okay. And these ones are your submental. Any tenderness when I'm palpating? Okay. And then I want to do your supraclavicular. So any tenderness as I'm palpating down here. Okay. So no lymphadenopathy noted. He's not having any tenderness, which is good. And then I'm just going to take another listen. I'm just going to listen over your temporal artery for any bruise, and then also just over both of your eyes, okay? We're going to do this with the bell of the stethoscope. Okay. Okay. Okay, so no bruise noted over either of those areas. for temporomandibular joint here, just for any signs of any crepitus. Go ahead and clench your teeth for me. Any tenderness with that? Okay. There's no crepitus noted on palpation. We're going to move on to your eyes next, okay? So we're going to go ahead and do your vision screening, as well as I'm going to do an eye exam. So what we'll do is I'm going to do your vision screening first. So I'm going to put this actually up here, okay? And I want you to read the smallest line that you can. We'll do one eye at a time.
Yep.
Go ahead and cover your right eye. Smallest line.
LTFPH.
Okay. Go ahead and cover your left. Yep. Smallest line.
LTFPH.
Yep. And then you can open both and read.
LTFPH.
Okay. And then what I want you to do is I just want you to read what this says down here. You can hold it just at breathing length there.
We'll chart 6 feet from eyes in good light. Check eyes separately, not with and without glasses.
Okay.
Chart based on a visual angle of 1.
Okay, good. Very good. So 20/20 vision for both of your eyes, so that's good. That's normal. That's what we like to see. You don't wear any contacts or glasses. What we're also going to do is test your visual fields. So what I'm going to do is I'm going to stand in front of you, and we're just going to test all 4 fields. So I want you to look straight ahead at me, and then I just want you to let me know when my hand comes into vision for you, okay?
Yep. It's in vision.
Okay. Same thing on this side.
Yep.
Okay.
Envision.
Okay.
Envision.
Okay, good. So normal periphery, that's good. We're also going to just take a look at your eyebrows here. I'm just going to inspect and palpate. Like I said, his hair is evenly distributed. There's no abnormal features that I've noted. Any tenderness with palpation here. Okay, I'm just going to palpate all the way down your orbital area. Any tenderness?
Nope.
Okay. Taking a look at his eyelids, he doesn't have any drooping, no ptosis noted. He doesn't have any redness or irritation, no drainage coming from either of his eyes. There's also no tremors or fasciculations, no swelling to either eye. We're going to take a look at your conjunctiva next, okay?
Yep.
So I just want you to look straight ahead at me. I'm just going to pull down on your bottom eyelid. Okay, so it's conjunctiva, nice and pink in there. I don't see any foreign bodies or objects. So that's good. There's no discharge. We'll go ahead and I'm just kind of going to stimulate your corneal reflex here. Just by touching you. Yep, blinking. Good job. Good job. So he blinks with both of those. So his corneal reflex is intact. I am going to take a look at his corneal clarity now. Just look straight ahead for me. It's just checking. Just to make sure everything looks clear. Yep. Okay. So normal corneal clarity. What we'll go ahead and do is just take a look at your eyes now. And the color of his irises are a greenish blue. They're the same. Okay. And then we're also going to just take a look at your pupil size and how they respond to light, okay?
Mm-hmm.
Okay, just look straight at me. Just going to shine this in your eyeballs. Okay, and they're kind of bright. So his pupils are 3 millimeters. They are round and reactive. They respond to light equally. I'm going to shine this right at your nose. Okay. Okay. So he has normal response to light and accommodation. He can focus on an object that's close and far away. I'm going to have you follow my finger, okay?
Yep.
This is just looking at your extraocular eye muscles. So his extraocular eye muscles are intact, and I just want you to follow my finger all the way in. Yep, good job. Okay, so no pupillary defects or nystagmus. His lacrimal glands don't have any drainage. They do appear pink. I'm just going to press here. Any tenderness when I'm pressing? Okay. I'm going to actually look in your eyes this time, okay? I'm going to rest my hand on your shoulder just for some support, okay? So this is going to be kind of bright. What I want you to do is just try and focus straight ahead. Straight at my nose the whole time, okay?
Yep.
So first we're going to look for the lens clarity and the red reflex. Okay, so he's got good red reflex. Yep, good red reflex in the left as well, or the left and the right. We'll take a look for your retinal color and any lesions that you might have. No retinal lesions. Okay. And this one's going to be kind of bright because I am going to get close to you so I can look at your blood vessels that are in your eye and your optic disc, okay? Okay. So we can see where his blood vessels and arteries branch out from his optic disc. He doesn't have any, what looks like any nicking. His arteries look good. His disc looked sharp. It was well defined, so that's good. It's a yellow to pink color. And then we'll also take a look at your macula. I'm kind of trying to give you a break here between shining the light in your eyeballs, so. Okay. Okay. So his macula looks good. It was a couple spaces away from his disc. I am going to have you look directly at the light for this one, okay? Okay. Okay. So like I said, macula looks good. Depth of his anterior chamber is normal. So your eye exam is done. Everything looked good. All were normal findings. What we're going to do now is take a look at your ears, okay? So just looking here, making sure that his ears are in good alignment. They should be about in line with the corner of his eye. The top portion of his auricle should. So it does appear on both sides that they are in normal alignment. They're not lower or higher than they're supposed to be. His skin color is pink. It's warm and dry on both sides. There's not any masses or lesions that I can see. He doesn't have any cysts. Let's see, no swelling or deformities noted either. Do you have any tenderness when I'm palpating either of your ears? Okay, so no tenderness noted. We are going to go ahead and take a look in your ears now. Okay. I'm going to take a look in this one first. So what I'm going to do is I'm just going to kind of gently pull up and away on your ear, okay? So right now I'm just looking in your auditory canal. I actually don't see any cerumen that's visible currently. There's no redness. His auditory canal is nice and pink. It doesn't look irritated at all. What I'm going to do is take a look up at your tympanic membrane. Go up and out. Okay, so his tympanic membrane's a nice pearly gray. It doesn't appear to be bulging. It looks normal in size. Go ahead and move to this side. I'm just going to do the same thing. I'm just looking in your auditory canal right now. So once again, maybe just a trace amount of cerumen in there. It's just a pale yellow. No erythema noted, no swelling or anything like that. I'm going to go ahead and take a closer look. I'm just going to pull up and out on your ear here. Okay, a little cold. Okay, so tympanic membrane is once again a pearly gray. No signs that it's bulging or that it's shrunk at all. There was no signs of any perforations in either side either. We're going to go ahead and do a hearing test on you now, okay? In this one, normally we would use a tuning fork to do the Weber and the Rhine test. However, we don't have those available, so we're not going to do that. We're just going to do the whisper test, okay? So what I want you to do is go ahead and kind of plug that ear for me. And then I'm going to say 3 numbers, and I just want you to repeat them back to me, okay?
Yep. 3, 9, 12.
Yep, okay. And then we'll do the same thing on this side.
4, 8, 7.
Yep, very good. So he did pass the whisper test. What we're going to do now is take a look at your nose. So I'm just going to palpate down the bridge of your nose here. Any tenderness? Okay, so his nose is in good alignment. Doesn't look like any deviations to it. We'll take a look up inside your nose as well. His nose is pink. It doesn't have any signs of cyanosis. Oh, excuse me. No tenderness, correct?
Nope.
Okay, and there was no masses on palpation that I felt. Go ahead and plug your left nostril for me and blow out your right. Okay, same thing with the other side. Okay, good. So patency in both nostrils is present. Okay. So this might be a little cold. I'll try to warn you as it's going in, but I'm just going to take a look here. Go ahead and look up for me. Yep. And take a look in your nostril. Okay. Same thing on this side. Okay, so no septum deviation. His septum is pink and intact. I don't see any lesions in his nose, as well as there was no swelling of his turbinates, no perforation, which is good. And then we already palpated your frontal and maxillary sinuses, and you didn't have any tenderness with those, so that's good. And there was no swelling with those either. So we'll take a look at your lips now, okay? So I just want you to relax. So your lips are symmetrical. They're pink. It doesn't look like he has any cracked or dry areas on his lips. No lacerations or open areas, anything like that. We're going to take a look at your teeth. So what I want you to do is just kind of close your teeth. Yep, that's good. Okay, so good alignment of the teeth. And then what I'm going to do is I'm going to just shine this light in there because I'm going to take a look at your, all of your teeth and your gums and all that good stuff. Okay. Go ahead and open your mouth wide for me. Yep. Okay. So it looks like he does have a filling on the right side. No caries that I can see on the bottom teeth. He's got a filling on, looks like one tooth on the upper right, as well as one of his posterior on the upper left. So his mucosa is nice and pink. It's moist. Gums don't, you can relax. Yep. Take a look at your gums here. Gums are nice and pink as well. What I want you to do is stick your tongue out for me. Okay, so tongue is nice and symmetrical. It's nice and pink and moist. Can you lift your tongue up for me? Yep. Looking at the underside here, no lesions, no swelling noted. Like take a look at your uvula and your palate in the back. Okay, stick your tongue out for me. All right. So uvula is visualized. It is midline, which is good. It appears to be pink. Okay, so tonsils are present. What we're going to do now is move on to your chest and your lungs, okay? So what I'm going to do is I'm just going to take a look just kind of at your respiratory rate here. So just breathe normal for me. So he's got a normal respiratory rhythm. No signs of apnea. He's not tachypnic at all. Okay, so his respiratory rate's about an 18. And then I'm just going to shine some light here, and I'm just watching your movement here. So there's no accessory muscle use when he's breathing. He has normal chest wall movement currently. And it is symmetrical on both sides when he's breathing. And he has equal chest rise and fall. We're going to go ahead and take a look at your AP diameter. So I'm going to take a look on this side. So we want the AP diameter to be a 1-to-2 ratio. You're okay, I'm just going to rest your arms to your side, yep. So his diameter is 1-to-2, which is good. And then I'm going to go ahead and listen to your lungs, okay?
Mm-hmm.
Okay, so take a deep breath for me. Okay, breathe out. Deep breath. Breathe out. Same thing again. I'm going to have you kind of rest your arm out. I'm just going to take a listen here. Go ahead and take a deep breath. Deep breath. Deep breath. Okay. Same thing on this side. Deep breath. Mm-hmm. Then you can just breathe normal, okay?
Mm-hmm.
So no lung sounds are clear, no adventitious breath sounds heard, so no crackles, wheezes, rhonchi, or stridor. I didn't hear any friction rubs. I'm going to just go ahead and palpate here. There's no crepitus on the anterior portion of his chest. There's no crepitus on the posterior portion of his chest. I'm going to have you go ahead and swing that way for me a little bit.
Mm-hmm.
Okay. And then we're going to just check your tactile firmitus here. Go ahead and say 99 for me.
99.
Okay. So tactile firmitus is intact. And then we're going to go down to about the 10th intercostal space. And I'm just going to take a look at your thoracic expansion. Okay. Go ahead and take a deep breath for me. Okay, another one. Okay, so thoracic expansion is symmetrical on both sides, which is good. Like I said, he doesn't have any abnormal breath sounds. Okay, so we're going to go ahead and measure your diaphragmatic excursion. So I'm going to palpate to the bottom portion of your scapula here. And then what we're going to do is percuss below it until we get a sense of dullness. Okay. And then we're just going to measure from there. It's about 3, which is normal. Same thing on this side. Palpate to the lower border of your scapula. Okay. We're going to measure from there. And it's about 3 again, which is good. So it is symmetrical on both sides. Good vocal resonance when you're speaking, so that's good. I'm going to take a look at your heart now. You can go ahead and swing back around. Okay. I'm just palpating here. So we're palpating to the right sternal border here. This is our sternum. We have our trachea. There's our notch. Okay. We have the base of the heart and the apex is down here. I'm going to go ahead and have you lean forward just a little bit for me. Yep. I'm just looking for any pulsations, heaves, or lifts. So I'm just feeling right now. So no pulsations or heaves or lifts to the right sternal border when he's sitting forward. None to the left sternal border when he's sitting forward. And none to the apex. Okay. And then I am going to have you lay down just on your side for me. And you actually might not have to scoot all the way back. Yep, you can lay down just like that first. That'll be perfect. Okay. So what we're going to do here is just take a look at your apical impulse. So on an adult, it should be your 5th intercostal space to your left midclavicular line. Go ahead and rest your arms at your side for me. I'm going to count down here. And the other place would be your 4th intercostal space if we couldn't find it at your 5th. I am going to lift your shirt up if that's okay. Okay. So apical impulse is good. Just going to take a listen to it here. So once again, 5th intercostal space. Okay. And while you're laying down, I'm going to go ahead and assess. Just take a look at your neck for any signs of any JVD, okay? All right. Then go ahead and kind of bring your neck up to your chest for me. Yep. Okay, and then back down. Okay, so he doesn't have any signs of JVD on either side. I can see where his carotid pulse is going on each side with inspection. So that's good. Yes. Can you roll to your left side for me?
Sure.
Okay, left side. I need this arm at your side for me. Yep. And I'm just going to feel for any heaves here. So none are felt to the right sternal border. None felt to the left sternal border. And none are felt at the apex either. So that's good. There were no thrills felt with the palm of the hand either. Okay, so you should be able to go ahead and sit back up. Okay, so now I'm going to take a listen just to your heart sounds here. I'm going to listen with the diaphragm and my stethoscope first. Okay, go ahead and hold your breath for me. So this is the aortic. S1 and S2 are observed at the aortic. You can breathe. Okay. Go ahead and hold your breath again for me. This is our pulmonic location. S1 and S2 are noted. You can breathe. Move down here. Go ahead and hold your breath. So S1 and S2 are noted at Erb's point. You can breathe. Go ahead and hold your breath for me. S1 and S2 are noted at the tricuspid point. You can breathe. And then go ahead and hold your breath for me. And S1 and S2 are also noted at the mitral location as well. No S3, no S4, no splitting noted. He does not have any other abnormal heart sounds. We're going to go ahead and listen to all 4 of those, or I'm sorry, 5 of those locations again, just with the bell of the stethoscope, just to listen for any murmurs. Okay, so no murmurs noted at the aortic. No murmurs at the pulmonic. No murmurs at Erb's point. No murmur at the tricuspid. And no murmur at the mitral location either. If there were any more murmurs, we would want to grade those, and then just pay attention to variation with respiratory phases. So now I'm going to take a look at your abdomen, okay? So what I'm going to do is I'm just going to pull your shirt up high enough here just to see. And just taking a look. There's no open lesions on his abdomen. His skin is pink and dry and warm. It is symmetrical on both sides. He doesn't have any obvious signs of any masses. And then he has normal surface motion as well. When he's breathing in and out, his abdomen moves with those breaths. We are going to take a listen just to your stomach now, okay? Okay, active bowel sounds in the right lower quadrant. Active bowel sounds in the right upper quadrant. There's active bowel sounds in the left upper quadrant. And active bowel sounds in the left lower quadrant. I now have to listen to you again. I just have to listen over your arteries that are in your abdomen for any bruits. So I'm going to do is take a listen in the middle here just to your aortic for any bruits. No bruit noted over his aortic artery. I'm going to do kidneys here. No bruit over the left kidney. No bruit over the right kidney. And then I'm going to have you lay back. Okay, just going to take a listen over your iliac and your femorals here. So no bruit over his right iliac. No bruit over the left iliac. Just going to feel for your femoral pulse there. Okay. No bruit noted over the left femoral artery. And no bruit over the right femoral. We'll go ahead and percuss all of your abdomen at this time. I'm going to lift your shirt up again. I apologize. Okay. So we're going to start in your right lower here. Just going to percuss. So we have dullness over his liver. If you get a little higher up, there's some resonance over the lungs. And we have some tympany over his stomach. Now what I'm going to do is I'm just going to take a look at your liver borders. So I'm going to go ahead and percuss again, okay? So the upper should be about the third intercostal space. We're just going to move down here. Fifth intercostal space. Right midclavicular. Okay. Looks like we have about 6. centimeters there. For his liver border, spleen dullness, we already heard. And then down here we have his gastric air bubble in his left lower quadrant, left of his epigastrum. I'm just going to go ahead and just lightly palpate. Just let me know if you have any tenderness when I'm palpating here.
Mm-hmm.
So starting in our right lower quadrant, just doing a light palpation. Any tenderness?
Mm-hmm.
Okay. What about up here?
Nope.
Okay. Here?
Mm-hmm.
Okay. Down into your left lower quadrant? No. Any tenderness around your umbilicus here?
Mm-hmm.
Okay. There's no bulges or masses around his belly button. Can you go ahead and lift your chin to your chest? Okay. So there's no signs of any hernia, no bulges or masses when he tucks his chin. We're going to go ahead and just locate your liver borders, which we already did, and then your gallbladder. We're going to do some deep palpation here. Okay, so gallbladder is the right upper quadrant. Deep palpation of the left upper quadrant for his spleen. We're going to do kidneys, which should be in our upper quadrants on bilateral sides. Any tenderness?
No.
Okay. And then there's no other masses noted. Go ahead. Actually, I'm going to just test your abdominal reflexes right now while you're lying down, okay? All right. So his abdominal reflex is intact. He has both, his belly button follows the direction of whichever way you're stroking. Actually, go ahead and sit back up for me. Okay, and then I want you to go ahead and swing your legs that way for me. Okay. And then what I'm going to do is I'm just going to you're going to feel me kind of thumping on your back here. Just let me know if you have any tenderness. Just palpating your, and percussing your costovertebral angles here. Any tenderness?
Mm-hmm.
Any tenderness?
Nope.
Okay, perfect. Then go ahead and swing straight for me. Yep. Okay, what we're going to do here is take a look at your blood vessels, but I'm also going to do kind of your musculoskeletal at the same time, okay?
Mm-hmm.
Let's see. All right, so I'm going to start in your hands here, just palpating your knuckles. I don't notice any nodules in your fingers here. Any tenderness on palpation? Okay. No crepitus or abnormal warmth in his right hand. No nodules, crepitus, or warmth in the knuckles of his left hand. Any tenderness when I'm palpating?
Nope.
Okay. Just going to move down. Any tenderness?
Mm-mm.
Okay. Any tenderness in your wrist on palpation?
Uh-uh.
Okay. And then there's no crepitus in his wrist on that side as well. Moving down your hand. Any tenderness?
Mm-mm.
Okay. No crepitus in the wrist on the right. Any tenderness in the wrist there? Okay. I'm going to feel both of your pulses here. Okay, so radial pulses are +2. They are regular. What I want you to do now is I want you to kind of hold your hands out for me. Yep. And then I want you to kind of bend them back as far as you can. Yep. Bend them down as far as you can, side to side. Okay. And then fingers, I want you to spread them for me. Yep. Any issues with any of those? So you have full range of motion. That's good. I want you to go ahead and squeeze. Yep. So good strength in bilateral hands. We're going to bend down. Yep. So I want you to not let me push up on your wrists. Okay. And then go ahead. Same thing. Don't let me push. Yep. All right. Then I'm going to palpate up both of your forearms here. Go ahead and relax your arms. Just feeling your brachial pulses. Okay. So good brachial pulses. They're both +3. Okay. And then any tenderness when I was palpating up. Okay. So muscles in both of his arms are symmetrical. They have normal contour. Skin is pink, warm, and dry. Like I said, they are symmetrical. There's no deformities noted that I can see. So what I want you to do is go ahead and flex your elbows all the way for me. Yep. And then straighten them all the way out. Okay. Good. And then don't let me push up or push down. Yep. And then same thing this way. Yep. Good job. Okay. We're going to palpate up your biceps here. Any tenderness when I'm palpating. Okay. So what I'm going to do is kind of go out, just palpating your bicep notch here. Okay. Same thing on this side. Okay, bicep notch, good. Both bicep muscles are symmetrical. Moving up to his shoulders. Both shoulders are symmetrical. Trapezius muscles are symmetrical. He does have normal contour. There's no warmth felt at the joints. Do you have any tenderness when I'm palpating? So no tenderness on palpation of the joints. What I want you to do is go ahead and shrug your shoulders for me. Yep. And then don't let me push down. And shrug your shoulders. Okay, good job. So full strength and full range of motion. Are you able to lift your arms straight out? Lift them above your head. Okay, and then you can put your arms down to your side. Are you able to tuck your arms behind your back for me? Yep. And then same thing behind your head. Okay, so full range of motion in both arms and shoulders, which is good. Okay. And then what I want you to do is ear to shoulder, both sides. Okay. And then chin to the ceiling. Yep. Chin to chest. Okay. And then are you able to kind of roll all the way around? Yep. Good. Then we're going to test the strength here. Go ahead and push against me. Yep. Yep. And then try and do ear to shoulder with me pushing. Okay. Okay. So he does resist against pressure. He does have full range of motion. No edema noted in either of his arms at this point. No fasciculations or spasms. So I'm going to go ahead and move down your stomach now. Okay. And just down your legs. And I'll actually probably have to... I already auscultated, your arteries in your stomach for any bruise. I'm just going to take a listen to your carotid artery for any bruise in your neck, okay? So go ahead and hold your breath for me. I'm going to have you kind of look that way a little bit. Yep. Okay, you can breathe. So no bruise in the left side. A little bit less. There you go. Hold your breath. Okay, no bruise in the right side as well. We're going to go ahead and palpate down your lumbar, cervical and lumbar spine here. Any tenderness while I'm palpating? Okay. Are you able to lean forward for me? Yeah, kind of like you're touching your toes. Yeah. So we've got good curvature of the spine here. He said no lumbar, thoracic, or cervical tenderness, which is good. Okay, you can sit back up. So I'm just going to move down your legs here, okay? I am going to have, actually, you're okay. I'm just going to feel your femoral pulses here. So left femoral pulse is +3. Right femoral pulse is a +3. Any tenderness in your hips on palpation? Okay. And then we're gonna just move. I'm gonna move down your thighs here. Any tenderness on palpation?
Yep.
So there's no lesions. His skin and his thighs is warm, pink, and dry. No signs of cyanosis. And take a look at your knees here. Any tenderness?
Mm-mm.
Okay, so no crepitus noted in his knees. There's no abnormal signs of warmth. They are pink and dry. And I'm just going to palpate behind your knee here.
Mm-hmm.
So +3 popliteal pulse in the right knee. +3 popliteal pulse in the left knee. Okay. And then I want you to straighten this leg out for me. Yep. And then bend it back. Any issues?
Mm-hmm.
Straighten this one out for me. Bend it back. And then I'm going to press down on your knee here. Go ahead and try and lift up. Yep. Same thing on this side. Okay, good. We're going to continue to palpate down here. Any tenderness? Okay. So there's no swelling or pitting edema in his lower leg or in his ankle at this time. Skin is pink, warm, and dry. He's got normal hair distribution. Skin is not shiny. We don't have any sores or lesions on either leg. Any tenderness?
Mm-hmm.
Okay. Lower extremities are both nice and pink. They're warm and dry. What I'm going to do now is just feel for your pulse back here. Okay, so +3 posterior tibial in the left leg. So +3 posterior tibial in the right leg. Go ahead, I want you to press out for me. Yep. Out again. Okay, and then in. Yeah, good job. Okay. I'm going to palpate your ankles here. Any tenderness?
Nope.
Okay, no crepitus on palpation of the left ankle. No abnormal signs of warmth. Skin is pink and dry. Any tenderness in your right ankle? So no tenderness, crepitus, or warmth in that one. Just feeling your Achilles tendon here. Just relax your feet. Okay, so no thickening noted of the Achilles tendons in either foot. And then what I want you to do is go ahead and, just rotate both of your ankles for me. Okay, so full range of motions noted in both ankles. And then go ahead and press up. Yep. And then press down. Okay, good. I'm going to take a look at your feet now. So I'm palpating down your feet here. Any tenderness?
Mm-mm.
Okay. Skin is nice and pink and dry. And it's warm. There's no signs of cyanosis. I'm going to just go ahead and take a look at your toes here and the joints. There's no crepitus or nodules noted in any of the joints. Go ahead and bend your toes all the way down. Yep, all the way up. And then can you bring your foot all the way up as far as you can? Yep, and then down for me. Okay, good. Same thing on this side. Any tenderness?
Mm-mm.
Okay. No warmth. There's no swelling in either feet. There's no nodules or crepitus in any of the toes. Can you go ahead and put your foot down? Yep. Same thing, all the way up. So full range of motion in both ankles and in both feet. Same thing with all of his toes. He does have all 10 of his toes. They're not cyanotic. And then I'm just going to test for any ankle clonus here. Just going to support. Okay, so no clonus noted in the right foot. No clonus noted in the left foot. And then could you just stand for me for just a second? Okay, so normal feet contour noted. He does appear to have a little bit of a flat sole on both feet, but no swelling, no deformities. Like I said, all 10 toes. Normal stance when standing, which is good. Okay, you can sit back down. And then I'm just going to feel your pedal pulses here. So he's got about a +2 pedal pulse in bilateral feet. His feet are a little bit, toes are a little bit cold. That's probably just the lack of the temperature in the room, though. Like I said, no edema there. Doesn't have any signs of any insufficiency for arteries or veins in his legs. What we're going to take a look at next is your reflexes, okay? Okay, so we're just going to kind of move up here with your reflexes. So I'm just going to kind of support your hand here. Just relax your arm for me. And then we're just going to strike kind of right above, about 2 centimeters above your wrist. Okay, good. Same thing with this side. Yep, just relax. Okay, both of those are brachioradialis' reflexes are intact. Okay. And then I'm going to strike you right here, okay? Okay? Okay. Okay, so good reflexes to bicep and his triceps. I'm going to go ahead and strike your knees here, okay? All right, so good in the right leg. Okay, good in the left leg. And then we'll also take a look. That was your patellar reflexes. Those are both very good. I'm just going to take a look at your Achilles here, okay? Just relax your feet for me. Good. Relax this one. Okay, so reflexes, all of his deep tendon reflexes are intact. They are normal for what they should be. And then I'm going to take a look at your feet one more time. I'm just going to look at your plantar reflex, okay? So what we're going to do, this might tickle a little, I do apologize. All right, same thing, outer side here. Yep, okay, good. So no abnormal findings testing his plantar reflex. So all of his reflexes are intact. He's got full range of motion. And he does resist against strength in all of his extremities, which is good. Do you have any questions that I can answer for you?
I do not.
Okay, well that concludes our assessment. Thank you very much.
Thank you.